It's a great honor to be able to come and speak with you for a few minutes today about overdose awareness and Overdose Awareness Day. As you may know, the purpose, for this particular gathering on this particular day is it's both National and International Overdose Awareness Day. It's important, I think, very important for us to understand just how many people are dying, have died from opioid overdoses. It's really rather staggering numbers. Nationally last year, it was over 33,000 Americans died from opioid overdoses. In Colorado, the number now is over 500, 504 last year that we're aware of. Not all of them are detected, obviously, but the ones we're aware of now is over 500. In the last dozen years, it's increased fivefold. Nothing else that we know of as far as causes of death has increased at that rate. Cancer is not claiming 5 times the lives it did 12 years ago. Nothing is. So I think the first thing to do is really to understand the impact of that. And each one of those 504 Coloradans is a son or a daughter or a parent or a friend or a coworker and is impacting communities. Sorry, I get kind of choked up at the start. At the very beginning, I never get through my comments if I start getting choked up. And that's, I think, very important for us to realize. One of my closest friends and colleagues, Lisa Rayville, standing over there, runs the Harm Reduction Action Center, and they have a wall of remembrance of people who have lost their lives to this problem. And if you have not visited the Harm Reduction Action Center and stood in front of that wall, I strongly recommend that after you're done here, you walk over there and do that and follow Lisa over there. You will be impacted tremendously, as I was, and it's very motivating. Because I think really the biggest message of all today is that losing any more lives, one more is too many. The vast majority, almost all of these deaths are preventable. A very small number might not be. Might be a strange reaction to a prescribed drug, and it happens, but it's extremely rare. What is all too common is unintentional overdoses that could be prevented and deaths that could be prevented. So that's the sobering news. But I want to offer some thoughts of encouragement and then some things that you can do, each individual can do. First, in terms of encouragement, as you've heard, recovery is possible. Treatment does work. It's difficult, unfortunately, to get people into treatment for a variety of reasons: capacity, stigma, willingness, availability, timing, coverage. Barriers are many. But recovery is possible. We have many excellent treatment partners here displaying and exhibiting today that you should check out because recovery is possible and treatment works. So that's important to know. It's also important to know that at all levels of government, and I work at the state level, working with the governor's task force or consortium, but at all levels of government, people are aware and working on this, and the attention has never been higher, which is deserved, and that is happening. So at the state level, we are doing things to try to help. There's an interim study committee at the state level that's meeting this afternoon, again at 2 o'clock, meeting all through the summer and fall to try to figure out what can the state do to help. And then we know that where the real action is at the local level with Denver Environmental Health, the Office of Behavioral Health Strategies, public safety. That's really where things happen is here in Denver. And we're very encouraged to, I'm a native-born Denverite, Park Hill, Manual High School, 1982, go Bolts. So I take this personally as a citizen of the city and county of Denver, native-born. Not many of us that are over 50 and native-born. So I take it very seriously and think that we need to work, and I look at Denver with a sense of both concern, but also a sense of pride. Despite the difficulties, there are many things going on here that are leading in the state and nation. And this is, believe me, this is all I do all day, every day. I've dedicated my career to this issue to try to help. And I look around and see things going on, like, again, the Harm Reduction Action Center. Or I look at what's going on at Denver Health, or behavioral health, or what's going on in environmental health with needle collection and collection of things that would be hazards for the community and the environment. Looking at the jails and partnerships to try to fill gaps. There are many, but to fill gaps in terms of getting people into treatment or to continue them with treatment so that we don't have so many problems every step of the way. So that's also very encouraging. And we're working now together in partnership at the state level with the city to try to help bring every resource that we can to the city and county of Denver to improve this problem. So that's encouraging. And the last portion of what I want to talk about is, what can you, as an individual, what can you do about this? What are some of the messages? The first thing I can tell you is you should be aware that with all these overdoses and the vast majority of them being preventable, you can save a life today or tomorrow. It's very possible for you to do it. You just need to get yourself some naloxone. This is a widely available now, almost universally effective, almost 100% effective overdose reverser that we have an antidote available that you should get and know how to use. We have a program here that, again, that person worked to help us get these laws passed to create standing orders in the state of Colorado where everybody, you may not know this, but you and I have a prescription for naloxone at the state level. We have a statewide standing order for naloxone. So you can walk into any pharmacy and say, I'd like to get some, please, by standing orders, and get it. It's the next best thing to over-the-counter. We're not the feds. We can't just make the drug over-the-counter, even though I'm pushing them to try to do that. This is where it should be. But you can't do that, but you can go to the pharmacy and get it. You can learn in 2 minutes how to do it. If you can squeeze saline nasal spray into your own nose, you can save a life. It's that easy to do. So you should have that and know how to use it. That's the first thing you can do. The second thing you can do is, if you are using an opioid, or you know someone who is, whether they're suffering from an opioid use disorder or an addiction, or they may just be on opioids for chronic pain, and they're at a relatively high dose, and they may not know it, but they may be at risk for one of those unintentional overdose deaths. People need to be aware of that, again, having naloxone available, but also learning about safe use, safe storage, and safe disposal. Using the drugs only as they are prescribed, not sharing them, not using them for something else, like, hey, I had this left over from my toe before, but I'm going to use this because my back hurts, or I have a headache, and I'm just going to start using that because I think it ought to work. I don't, no one should play doctor. Go talk to your doctor. If that's appropriate, have them tell you that. Just don't use them for whatever. Storage is also important. The most common way people end up, unfortunately, either in addictions or overdose deaths, is by starting off with leftover medication in a family member or friend's medicine cabinet. It's the single most common pathway to misuse, then later tolerance, dependence, and addiction and death. And the easiest way is to store your medication safely in the least obvious place, not the medicine cabinet. Whatever you do, don't store your opioids in the medicine cabinet if you're using them. It's the first place that your kids go. They're smart, Mike, I have kids. They're whip smart, and they'll know where they are. And so will your neighbor, so will your plumber, so will your realtor. Everybody knows where they are. And our biggest supply of opioids in the country is in our own medicine cabinets. So please check your medicine cabinet. If you have anything left, dispose of it. And if you don't, and you still are using that, store it somewhere else safely and securely where no one can find it, and treat it that way. And last but not least, the very best way to minimize any chance of becoming addicted or having an overdose death from an opioid is to not take them in the first place. There are a lot of alternatives now available that work actually as well or better than opioids. For example, if you've ever heard of the drug called Tylenol, which I'm expecting people probably have, or if you've ever heard of ibuprofen that you can buy in jugs of 1,000 ibuprofen for $4 at any large retailer. If you use those two, that's all I have in my house for pain relief. And I know the literature as well as anybody. That's all I do. I'm a nerd, self-professed nerd. All I do is read all the time. And if there was better, I would know about it. And I would want to take it, of course. I want the best available pain medications. I manage things like that, and we're using things like longer-acting anesthetics that last for 2.5 days instead of 2.5 hours to manage pain for dental procedures, or even for hip replacement, shoulder replacement, spinal fusion, things where you would think, I got to have opioids after that. Doing them completely opioid sparing. 2 days of long-acting anesthetic, followed by nonsteroidals, and only 1 out of 10 patients ever needs to even take 1 pill of an opioid. So the best thing to be thinking about is talk to your doctor about, do I need one? Because unfortunately, we've gotten into this world of pain equals opioid. And we have to unlearn it and start asking questions. And there's some sheets back here that, sitting at Reggie's table. For example, things you can ask your doctor. What kind of pain do I have? Do I need an opioid? What else could I get? Ask those questions up front. There are many alternatives, and your best way to avoid opioid addiction is don't take them at all if you don't need to. And if you do, use them safely, store them safely, dispose of them safely, and then ultimately, again, please be aware of and use naloxone and have it available to save lives while we hopefully get all people who need it into treatment. So those hopefully are things that you can do. I really want to thank again everybody for coming. Thanks to the city, to the mayor, and to the offices. Look forward to collaborating and working with you to try to help solve this problem. Thank you.